Hi there, everyone. Hopefully, you guys can hear me. I'm coming on a few minutes late here. Did have a little bit of a challenge getting on, but I do see that we have a couple people here already. So thanks, guys, for joining. This live was scheduled maybe a week or so ago, and I'm gonna just kind of go with how I've done the previous lives, and I've tried to do these about once a month, mainly with the goal of answering some questions and engaging with you guys a little bit more in real time. But it's mainly focused to have you guys ask questions in real time about the PMHNP role and some of the things that maybe you've wondered about, aren't sure about, or maybe that you've encountered on your journey as a PMHNP or as a student, or if you're considering the role. I'm Camellia, by the way. A lot of you have followed me for some time, and I'm just taking a few minutes after a long day of work to just engage with you guys a little bit. So certainly, if you have any questions, you can put those in the chat. I did actually do something a little different this time. Hi, Darlene. I see that you're here. Thanks for joining. I did actually have a little bit of a different approach this time, and I know a lot of people can't usually join in real time, and so I did have a couple of questions that I wanted to share with you guys during this live from others that were not able to join today, or that may be joining but did send some questions ahead. So we'll spend some time answering those. Um, but for you guys, if you want to just send me i- uh, in the chat, if you want to put a question there, that's sort of how we'll approach it. If you have any questions about the PMHNP role, hopefully this day has been great for you guys. It's now about 6 p.m. Eastern Standard Time, and I don't plan to spend a whole lot of time here, about 30 minutes or so. But certainly, I'm going to dive into a couple of questions here. If you have any new ones, please feel free to put those in the chat. And then lastly, what we'll do is end with some updates for what's going on in the psychiatry world, which I try to keep you guys abreast of those changes, as I'm also working and doing the work as a PMHNP actively. There are things that we all should be aware of that's happening in this world. So I'll share some of that as well. I'm just going to go ahead and start with a couple of questions that came before the live. And you guys can tag on to those questions, if put those in the chat if you have questions for me about the PMHNP role. I see a few more of you have joined, so thank you so much for doing that. But I'll just dive right in and start answering some of the questions that are already here. And the first question is, how often do you find that you need to treat or refer for physical conditions that contribute to or exacerbate mental health conditions? Great question. This actually came from another subscriber before this live. And, um, the real overall answer to that is when you are a PMHNP or as a PMHNP, we are trained to kind of be able to critically think about the big picture. So, the way that I see this in terms of treating and referring for physical health conditions, it's something that we should all be always kind of assessing and thinking about. So much that I actually I spend quite a bit of time in my initial assessment with patients talking about their physical health. And a few questions that I usually ask patients. Usually, I want to know, are they diagnosed or treated for physical health conditions? Are they seeing a primary care doctor? Have they had labs, and how recent were the labs? And sometimes I get it as specific as talking about which labs were actually drawn for the patient and the results. The reason that's important for us on this side in psychiatry is because we know that there can be overlap for physical health conditions and mental health conditions, which can contribute to changes in mood, can contribute to changes with depressive or anxiety symptoms. And so, it's something that we should always be thinking about. Um, I also ask patients specifically about their thyroid function, B12, and sometimes vitamin D levels, because those can give us some insight as to kind of some of the symptoms that we see along the lines of depression and anxiety, sometimes even things that mimic bipolar disorder. So we really want to be having that at the forefront of our thinking and critical thinking with each patient encounter. Um, Additionally, if you have a patient, or if I have a patient that I am already treating and I've been treating for a while, there are times that we have to revisit, maybe what those labs are, or maybe what they are now, meaning rechecking those labs, because maybe something has changed. If I notice that a patient's resistant to treatment, they're not responding as well to things, those would be really kind of check boxes to think about. Is it something else that we're missing? And so you kind of always want to be thinking about the etiology of things as you're going through, and as you are assessing patients, always considering what else. And that really just helps you to tune things in, as you're working with patients, to see if there are other underlying things that could be contributing to their symptoms. Okay. So it's a long-winded answer, but it's not really, absolute. But when we're thinking about the patient from a big picture, we do need to always be thinking about their physical health, and that includes labs or other conditions that may be contributing to their symptoms. Okay. So hopefully that answered the question. Those of you that have just joined, if you want to just put a question in the chat, if you have other questions, I did have some questions ahead of time that I'm actually reviewing now. The second question that I got ahead of the live was, do you develop a sense of how well someone is going to respond to medication? Or is it always wait and see? Um, this is a great question. And the thing about being in psychiatry, and sometimes even with physical health things, is that, we don't have absolute ways to understand or know if a patient is going to respond or respond adversely to a medication. So it typically is a wait and see. When I am diagnosing and considering treatment by medications, I really think about the patient's history. And the history is the most important. Understanding what their presentation of symptoms are. There are clusters of symptoms, as I like to describe them, that kind of fit the mold for certain conditions and that may fit the mold for characteristics of certain medications. So I'd certainly use the history as a guide for this. Also, if a patient has responded well to a medication in the past, doesn't mean that we shouldn't go back or consider that medication at some time later. So you really want to get a good history of the patient, in terms of what medications they've taken, how they responded, what they remember about the medicine. And I do spend quite a bit of time on this as well with patients in the initial visit. I do ask them specifics about what they remember about previous trials of medications. In most cases, it is going to be a wait and see. So the other part about that is being sure that you set up realistic expectations with patients, so that they understand that this is not going to start working tomorrow based on most medications, but this is something that we may see some benefit in the next couple of weeks, maybe even 3 to 4 weeks. But maximum benefit may happen around another 6 to 8 weeks. So I think as long as you set that expectation with patients, they know what to look for. And if there are adverse responses, I also review that with patients. What is our process for managing those things if something does come up before we're scheduled for the next visit? So everyone's way of doing that is a little different, but to answer your question, the wait and see approach is definitely what most of us do, and how we frame this for our patients to understand that it is going to take time for these medicines to start working. Um, there are more ways that we have gotten a little closer to being able to determine, what medications patients may respond to, and that's with, psychogenomic testing, pharmacogenomic testing, and pharmacogenetic testing. We do that where I currently work, and it has been a good clinical guide for me. It's not absolute, but it does basically categorize different medications for patients to understand, based on their genetic makeup, if they may have an affinity one way or the other for responding to medicines, or one way or the other for having side effects to medicines. So I do utilize that probably more than I've done in the past, because it can help to fine tune your treatment with patients. Okay. So I know that was also a long-winded answer, but a lot of this is pretty subjective, and you're going to find that everyone does things a little differently when it comes to how they manage and treat patients. That's just the way that I've been used to doing, and that's just the way I manage patients. But I'm looking for some questions from you guys. I don't plan to be here very long. We're about 10 minutes into this live, and I probably will stay around for another 15 minutes or so. But I am looking for any questions that you guys have for me about anything in particular about the role. If you're a student, maybe you're practicing already, maybe you're an FNP. Anything that you guys want to ask me, please share that in the chat and I can answer that in real time. So I will take a few minutes to do that. And then I plan to actually share a couple of updates with you guys as well. But any questions that you guys have for me? Anything you guys can think of. And no question is a silly question. I actually had quite a few very good questions at the last live. These are always recorded, by the way. So if you missed the first couple of questions that I just answered, you can always come back to this, and this will be posted on my page after this ends. Okay. Any questions you guys have for me about the PMHNP role, or what's going on with the role, or anything that you want to ask? I will just wait here for a few more minutes. Any questions you guys have for me? And I don't see any questions so far, but I did just, I actually pinned the questions that I just answered as well. So you guys can see what others have been asking. But I did just answer those questions, and you can refer back to this later. Mainly about physical health conditions and assessing for those. And the other question was about medications, patients' response to medications, and the approach for that. But any questions you guys have, anything you want to ask me, please feel free to do so. I will move forward. I'll wait on the questions, but as I'm waiting, as we're waiting, I did want to actually share an update, which most of you know if you're practicing as a PMHNP. I did share this on the live a few lives ago that the DEA rule that applies to the public health emergency that was instated in 2020 that has to do with telehealth regulations and prescribing controlled substances. That rule has recently been extended again. So it was extended earlier this year to November, and now it has been extended through December 31st, 2024. So um, I did drop the link for if you want to know more about that rule and the extension. I did drop the link for that here on the chat as well. So feel free to look at that, and that will give you some insight about sort of what all of this means. For me as a telehealth provider, it means that I can continue prescribing controlled substances for patients when it's necessary without having them be seen in person quite yet. I have still been referring patients in person just to meet that criteria in anticipation of having to meet the criteria. However, in terms of it being mandatory, that has been extended through the end of next year. So that could be good news. I know there's been a lot of pushback with that, but it is good news for most patients because they're not having to really scramble to continue their care. Um, I will say from a treatment perspective and as a provider, you guys, if you're a new PMHNP or if this is something that you want to do by telehealth, because of this change and because we're anticipating that eventually the change is probably going to be where the patient has to be seen in person at least once. Be sure that you're focusing on your job selection strategically around that, or if you are someone who wants to open your own practice and you're doing telehealth, be sure that you have a physical location that you're able to see patients when the time comes. Okay. So I just like to say that be prepared for that. But again, if you want more information about the DEA rule extension as it relates to the public health emergency that has been extended, I did drop the link for that here on the chat. Okay. I'm gonna move on because I have a question here. From Darlene, thank you for your question. How do you approach a new patient who is asking for a controlled substance? I just need refills for whatever the medication is or a huge amount of medication. Good question. And I can tell you that this gets pretty sticky most of the time. Um, I always tell patients from the initial visit that we are treating this as an initial visit. And we basically will be going through questions that pertain to their history. They were probably working with another provider who did things a certain way. However, we are treating this as an initial visit. And I do set that expectation with every patient from the initial visit. That's because patients have just to get them to understand that you may have a different approach and a different way of making clinical decisions. And so, one that helps with the expectation that you're just going to continue what the previous provider did. Secondly, when they're asking for huge amounts of controlled substances or things that you're not comfortable with, you still have the authority and the right to um, do what you feel comfortable doing in terms of safety, in terms of what you are treating the patient for and with, and your own discretion as a provider. Okay. So, one, set that expectation with the patient. If you're seeing them for the first time, this is my first time seeing you. We're going to treat this as an initial visit. I'm going to have lots of questions for you about your history. It may be redundant, and we'll talk about your treatment plan at the very end of the visit. Once you talk about the treatment plan, understanding that this is going to be my discretion and anything that I don't feel comfortable doing or that I don't feel is safe, it it may be different than what you've been used to or from the previous medication regimen. Most patients are okay with that and they understand. Um, but you really have to be sure that you set that expectation from the beginning so that there's no assumption that you're going to be continuing things that you don't feel comfortable with. Okay. And we can talk offline if you want about that. There's different approaches and different ways that I do that with patients, but I don't get into the woods of doing things just because it's been done. And sometimes when you explain to patients that this is the reason that this is not safe for you. Sometimes it's lack of knowledge. Other times it may be just sort of not understanding maybe what medicines are for, how they should be used. Use that time to educate. And a huge part of our role is education. So you want to be sure that patients understand what am I being treated for? Why am I being prescribed this medicine? And how should I be taking it? And I do review that quite often with most of my patients every time, especially if it's a new patient that comes to me who's already been prescribed medications. Okay. So I hope that helps a little bit. It's a gray area, and it's one that, comes up probably more than we want it to, but I'm happy to answer any other questions for you offline as well if you have specific things that you want to ask me there as well. Okay. Um, I have another question from Chain Breakers with Dr. Trista. I love the name, by the way. You asked me, do you have experience with locums tenens work as an NP? That is one area that I do not have experience in. I have worked in different settings per se, but it's always been either a part-time PRN position or it's been full-time W-2 and a 1099. I've done both of those, but I've never worked as a locums provider. Um, I've never worked with an agency either. So that's a slightly different sort of avenue. Can I say that I've never considered it? No. I may consider that sometime in the future. But if you have specific questions about it, you can let me know. Otherwise, I'm not really versed in that area. Um, I have colleagues that have done it though, but I myself have not worked as a locum tenens. If you have questions for me though, things that you're considering if you are thinking about being a locums provider, shoot those to me and I can try to answer them. But that's not an area that I've had a lot of experience. Okay. Um, And Darlene, you said I appreciate your answer. I've been in FNP and went back to school for PMHNP. The nuance of bedside is interesting. And in any case, thank you. You're welcome. No problem. No problem, Dr. Trista. If you have other questions offline too that maybe I can research or get answers for you with my colleagues, I'm happy to do that as well. But just let me know. Okay. And I keep saying, offline, you guys can contact me by any of the means of communication. If you go to the About section of the channel, you'll be able to see different ways that you can contact me if needed. Okay. Um, and I have Shannon. Thank you for your question. You said, "Am I in private practice yet?" You're a fellow North Carolina PMHNP. I am not in private practice yet. I think I mentioned this at my previous live that it's something I've been considering, and just kind of working through the kind of regulations and understanding it better, mainly for liability and just understanding what I'm getting into. I have worked in a private practice. And so I do know the challenges that come along with that. And I honestly think that that's probably what holds me to not jumping into that too quickly. I've worked with another provider who owned the practice, and there were some challenges with it. And I want to be sure that I'm prepared for that. So, no, to answer your question, I have not delved into that quite yet. Is it a part of my future? Highly likely. But I'm interested to know, Shannon, for you as well. Are you in private practice, or tell me more about what you're doing these days? Any questions, other questions you guys have for me? Anything else that you guys can think of? I see a few more of you have joined. This has been pretty informal just to answer questions that you guys have about the PMHNP role. I had some people that messaged me ahead of time with questions. So I answered those initially, but this is recorded in case you joined late. But I'm happy to stay around for another couple of minutes to answer questions that you guys have. There have been some great ones so far, and would have be love to answer anything else that you guys want me to right now. Any more questions you have about the PMHNP role? And Shannon, please feel free to contact me also offline. I'd love to know where you're practicing currently in North Carolina. Yeah, yeah, I understand that. So you have a partner that's going in with you to take some pressure off. Yeah, yeah, and I think that's probably I actually have a couple more colleagues that are doing the same thing. It probably does support you better to go in with someone else. There are things to learn, and there's definitely, curves that you kind of have to be prepared for. um Things around credentialing and billing, and just keeping up with a lot of that, as well as your marketing and the things that you do as a business owner. Yeah. Okay, great, Shannon, sounds good. I look forward to hearing from you. um, Thank you so much. Any other questions you guys have for me? I'm only going to stay on here for a few more minutes, but I'm happy to answer questions that you have about the PMHNP role, and anything else that you guys have come across in you on your journeys. Any other questions? And just to reiterate, I did drop there's a link that I dropped to talk about the DEA extension, the DEA rule. I did drop a link for you guys to refer back to that. If you don't know what that's about, you can check that out and go back to the beginning of this live. And I talked a little bit about what that means. Okay. But basically, essentially, we're going to be practicing and able to practice by telehealth and prescribe controlled substances through the end of next year. So that's the change. But I did drop the link here with that more information. Okay. Any other questions you guys have before we end today? And I'm going to try to do these lives about once every month. We're a little bit over a month this time. But certainly, the goal of these is just to engage with you guys, to answer questions that, most of us have the same questions. That's what I've learned along this process. And so if you have questions, feel free to ask those. And my goal is just to connect with you guys and answer as much as I can. Okay. Tips for how to get over imposter syndrome. Very real question and a very real thing. I think we really have to think about, the source of where imposter syndrome comes from. And I think it's pretty normal to have some level of that, if you're starting out in anything new. I think what's important is when you're going into something new, like if you're a first time PMHNP or a nurse practitioner, you probably are going to experience some level of that if you've gone from nurse to NP, because you're doing something completely different. And that in itself, when you're adjusting to things, you tend to have kind of this lack of confidence and just the inability to feel like you're doing a great job. And I will say that it takes time. So one, your awareness around what you're feeling is important. Secondly, understanding where your source or lack of confidence may come from. Is it that you truly aren't understanding things? Is it that you don't feel like you're making good connections with your patients? What is the source of that? I think is important. And then when you identify where your challenges are, or maybe where your growth points are, then I say go for more, do more things in that area. I'm huge on growth and personal and professional growth. But I think the only way to overcome things that you feel less confident in is to do more of it and to really engage yourself in the discomfort. Um, I certainly had imposter syndrome as a new nurse, and I had imposter syndrome as a PMHNP. So I'm very transparent about that. The only thing that really helped me over the hump was practicing more, going back to understand the things, or going into things more that I didn't quite understand as well, and giving myself some grace and understanding that it's a part of the process, and that it does take time. It takes time for us all to get adjusted. And mentorship is a huge piece of it as well. I can truly say that I came through my program at a time that I had some very good mentors, that were PMHNPs. When I came through about 6, 7 years ago, you know, there weren't many PMHNPs in my area, but the ones that I was able to do my clinicals with and things, they did serve as more of a mentor for me as well. And so, just being able to connect with someone who's been there, someone who's done that, someone who may have had the same sentiments about certain things, or maybe even the same challenges, I think is important. So wherever you can connect yourself with someone that can be more of a motivator, but also to acknowledge what you're feeling, and help you to identify maybe where you can grow, or maybe where these challenges are coming from. And I think having that support is important. Everyone doesn't have the leisure of getting a mentor, or having or establishing someone that they feel that they can have as a mentor. But definitely seek those opportunities out, to really help you to grow. And that can even be a psychiatrist. Maybe it's someone that you've done your clinicals with, that you felt like you had a good connection with, you learned from, um, and that you think would be good for you going forward in your career. I still touch back with the same people that I found as mentors initially for me. I don't lean on them quite as much, but certainly they were mentors and have continued to be for me to help me through that period. So there's different ways to handle it, but acknowledgement of what you're feeling, the why of what you're feeling, and then seeking out opportunities and additional support is how I would generally answer the question on how to overcome imposter syndrome. Yep. Very good question. And honestly, it's very common. Very common. Yep. Thank you for your question, Dr. Trista. Um, any other questions you guys have? I've had quite a few of you join. So I do want to make sure I'm not overlooking anyone, or that you have the opportunity to ask a question if you have one. This will be recorded as well, so you can certainly come back to this if needed. Absolutely. You're welcome. No problem, Dr. Trista. And if anything offline you want to ask me, you can as well. The about section of my channel gives the a few different ways that you can contact me. So you guys can certainly do that if sometimes people don't feel comfortable doing this publicly. So you can certainly do it that way as well. Okay. Um, I'm glad that you caught this as well, Darlene. Thank you for joining. I usually post when I'm going to do another one. That's on like the community or message board or whatever that's called. So usually I try to do these once a month to just kind of informally go through this just like I did today. So feel free to join those in the future. And I did also miss something from you, Dr. Trista, that you are supposed to be starting inpatient as a new grad, but you're scared. It's a state hospital. Yeah. So you're going to see a lot in a state hospital. I think that goes without saying. And, as a new grad, what's going to be most important for you is the level of support that you feel like you have. And that includes the supervising physician, that includes maybe a mentor, that also includes your supporting staff. State hospitals can sometimes have more of a reputation of not having as much staff, or you are going to be managing the severely mentally ill. And so that SMI population is a lot higher in a state hospital. Yes, you'll gain great experience, but I think what's going to be most important for you is the support. Yeah, very, very important. And congratulations, by the way, you're a new grad PMHNP. I didn't say that. Congratulations. Yeah. Um, any other questions, guys, before we end? Hopefully, this was helpful for you guys. This will be posted here shortly to review this again, if you'd like. I appreciate you guys for subscribing. Thank you for asking all the questions that you have. Darlene, you used to live in North Carolina. You're back to New York. Good night. Yeah, so keep me posted, guys. I love to also hear the journey that you're on and the successes that you have. Many people touch back to me and tell me kind of where they are, and I do appreciate those. That keeps me motivated as well. But thank you all for joining tonight. And Shannon, you're welcome. I do see your message here about my videos. Thank you so much for referring others as well. So I'll try to maintain this and keep this up. If you guys have other things you want me to talk about, feel free to let me know. Contact me outside of this platform. And I look forward to seeing you guys in the next live. All right, you guys have a good evening. Bye bye.